We are live. Good morning. How is everyone doing? Dr. Greg here, back with our third live YouTube Braces Explained session. I usually ask you guys to let me know if you can hear me and see me. So instead of asking yes or no, let me know what color you're rocking on your braces right now for the holidays, because as you guys know, Halloween is just around the corner, and Halloween is my birthday. I'm turning the big 3-0 this year. It's kind of a crazy year to turn 30, but you know what? I'm super grateful for everything I have, as well as all of you guys. So with that being said, today's live is going to be a little bit different. It's not going to be answering questions from the last video. We are going to answer questions from the previous video. But what I'm going to do today is I'm also going to talk about what I was going to do in my next video. So, all right, cool. Seeing the colors rocking in. Awesome. Orange and black. That's what I'm saying. It's Halloween. You got to do orange and black. We ran out of black last week for like one day in the office, and I was like, I don't know what to say. Like, we don't have black, but we're good. We're fully stocked. All the colors are in. We're good to go. Thank you for the birthday wishes. You guys are awesome. So, cool thing about this weekend's video too. So like I said, last video was about treatments for missing teeth, and I was gonna do a video this week about the causes and the problems of missing teeth. But I figured it wasn't that popular of a video amongst you guys. I don't know why. I guess it wasn't 100% braces related, but that's totally okay. But I promised that I was gonna do that video, and I think I'm gonna just do it in the live today. I'll answer it kind of quickly, answer videos from the last video, answer questions from the last video, and then we will move on and take some questions, okay? So with that, it looks like we have people hopping in here. Awesome. So one of the questions that really hopped out, it was actually on the Braces Club last night, and I wanted to address it before talking about the causes of missing teeth. And someone asked, I forgot to write down the name, but they asked, if you get a replacement for a missing tooth after you've had your braces done, do you need to get a new retainer? And the answer is yes. The reason is because your retainer holds your teeth where they are when your braces are done. But if there's a tooth missing and the retainer is, filling that spot, if you get a replacement tooth, it's not going to be able to sit. It's not going to fit. So if it doesn't fit, it's not going to hold the teeth. So yes, if you do have missing teeth and you have braces, let's say they open up space for an implant, or they're holding space for a bridge or something like that, then you absolutely do need to get a new retainer when it's done. And generally I say plan it to coordinate it so that you can get it done like ASAP, so that the teeth don't shift, especially if it's if it's very close to getting your braces off, because in the first couple of months is when you're most likely to have relapse of those teeth, right? Awesome. Having a lot of questions here. All right, guys. So what I wanted to dive into, as the title of today's video explained, was I want to talk about the causes of missing teeth. And there's 5 main causes that I want to talk about. There's some other ones that are like really minor. Not going to dive into it too much, but what I want to talk about are this really quickly, and then we'll answer some of your guys' questions from today's feed. So just drop your questions in the comments and I'll address them as they pop in here. Okay, guys? Let me see here. Awesome. Okay, cool. So the first cause of missing teeth that I want to talk about is caries. And caries are another word for cavities. We've talked about this before, but cavities are basically what happens to a tooth if it is being rotted away by bacteria in your mouth. In cavities, we've talked about what causes it, but it's basically the bacteria in your mouth creating acid, and that acid dissolves away the tooth structure. Now, if it dissolves away a little bit, you can get a filling, or if you need a little bit more, you can get a crown. But let's say it goes so far that it goes down into the gum levels and the teeth actually chip and stuff like that. At a certain point, a tooth is deemed hopeless. And when a tooth is deemed hopeless, it needs to be extracted, and that causes a missing tooth, right? Another cause for tooth loss is periodontal disease, and this is actually the biggest cause of tooth loss. And what periodontal disease is it's the fact of bone loss. So if you're having a lot of bacteria on the gum levels under the gums, what happens is, and we've talked about it before, is your bone levels try to recede away because they're trying to get away from the bacteria, right? So this is why it's so important to brush and floss the gums, not just the teeth. Sorry, I got a little something in my throat. This causes it so that it prevents the bone loss from going down. And when you lose bone, the reason that you need those teeth to be extracted is because what happens in those cases is it's like the foundation of the house being eaten away. So it's like basically termites eating away the foundation of your house. It makes it so the house is mobile. And that's one of the main reasons for tooth loss. And the crazy thing about gum disease and periodontal disease is that it doesn't hurt most of the time. It's kind of like the silent killer. You know, they say like diabetes is the silent killer or heart disease for life. Well, periodontal disease is the silent killer for tooth loss. So it's really important to get that taken care of. And that's why it's so important to go to the dentist regularly for cleanings and exams, okay? The third cause, these are kind of like hand in hand, it's trauma and cracked teeth. Now, trauma is basically if you get hit or you fall, and it basically makes it so the tooth is like knocked out of your mouth. So that's a definite reason why you would have tooth loss, right? Because if you can imagine, if a tooth gets knocked out, sometimes we can put it, if it's fast enough, we can actually put it back in and it refuses with your body and all is good. But sometimes you can't. So that's why it's so important that if you have any trauma, get a hold of a dentist ASAP so that we can either splint it or have it replaced, okay? Running through these pretty quick because I don't know how much you guys are interested in these missing teeth, but I feel like it's important to talk about, especially on a dental channel. It's really relevant, you know? And then the other one is a cracked tooth. Now, my mom actually just got a cracked tooth about a year or two ago, and some small cracks are fixable with a crown, which means that it goes around the tooth and it kind of protects it, it holds it together. But if it's a crack that goes down into the root, there's nothing you could really do in those cases except extract the tooth. And it's unfortunate, but this can occur by eating things that are hard. That's why people that eat jawbreakers don't eat jawbreakers. They're like terrible for your teeth. They increase your risk of cavities and they increase your risk of cracking your teeth. Also, people that chew ice, big reason why teeth crack is people that are chewing ice. Okay? So, cracked teeth, trauma, cavities, and gum disease are the 4 things we've talked about so far, which are big causes for missing teeth. And the 5th one I want to talk about is not your fault at all. If you are congenitally missing teeth, which means that you were born with certain teeth missing. Now, certain people are more prone to this, and there is some sort of a genetic component to it. I was actually talking about it with my buddy, Dr. Sammy, last night. He has his own YouTube channel, Smile Influencers, and I think he's on here, so I got to give him a shout out. But we were talking about a lot of people that have congenital missing teeth. It's a genetic thing, and there are certain teeth that are more prone to be missing. Wisdom teeth are the most common to be missing because we're slowly evolving away from that. But the other ones that are really common are actually your lateral incisors. And I don't want to put my hands in my mouth, but the lateral incisors are these guys. Not the front 2 teeth, but the ones just to the side. Those can either be missing or sometimes they're peg and they're smaller. So if you're missing those, you're going to have some sort of a treatment like we talked about in that last video. And there's other ones that are commonly missing. The lower second premolars, those are missing sometimes. So if any of you guys have missing teeth, let me know in the comment section so I could chime in here and kind of answer your questions, because I am wrapping up this little segment and then I'm going to answer your guys' braces questions, okay? All right, awesome. Sorry, I had to run through that. Oh, one last thing. What can happen if you're missing teeth? Well, there's a few things that can happen, okay? One of the things is that the teeth can drift forward into that spot. So let's say you're missing like a premolar. Well, what happens is your molar can drift into that area. And if it drifts in, the teeth kind of lean together like this. And that makes an area where it's really hard to clean. Food can get stuck in there. So either close the space or open it up and get like an implant or something like that in the space. Another thing that can happen is that teeth can do what's called Supra Erupt. Okay, so to explain that, let me pull a few teeth out of this poor patient's mouth here. You guys let me know why I'm pulling these out. Is it bone loss? Is it cavities? You let me know. Okay, so what Supra Eruption is let's say it's something like this, right? And you're missing all these teeth in this quadrant. What can happen is these teeth don't have anything to stop them from erupting. So what tends to happen is they will extrude. Let me just extrude these guys for you a little bit and show you what I mean. They will extrude and invade the level on the bottom, which makes it so that you start biting on your gums, which is 1, painful, and 2, if you want to end up getting implants in here, they won't fit because you need a little bit of vertical room for them to fit. So what you would need to do is orthodontically either intrude these teeth, or in some extreme cases, you have to actually extract all these teeth and get implants on the top and the bottom. So if you are missing teeth, it's really important that you get them taken care of ASAP, or at least have a dentist that's on board with a plan to treat those teeth. Okay? Okay. We answered those questions, and I fulfilled my promise of last week's video that I would address the causes and treatments, or causes and sequelae of missing teeth, okay? Impacted canines. Hello, Jazzy. I see that question. Great question. Want to do a whole video on that one very soon. Speaking of which, I told the people on the Braces Club last night that I would be announcing in today's video, in today's live, what this weekend's video is going to be about. and I'm actually really proud of this video. I haven't finished it yet, but I was actually able to film a live patient procedure this last week, which I've been super uncomfortable about doing. I felt awkward asking my patient if I could film them, and I'm actually I have 2 of them now, so we're gonna be editing those, and I'm gonna be doing a live putting braces on video this Saturday. So 8:30, it's not 8:30, 8 a.m. is when the videos come out. You have to sign up and subscribe if you haven't already, and then visit that video Saturday 8 a.m. It's gonna be amazing. I'm excited. It came out pretty good. One of them I had my loop light on and it made it look too white, but we'll deal with that later. We're learning as we go through this because it's a learning process for all of us. I'm learning how to get better at YouTube. You guys are learning about braces. The world's an amazing place. Let's do it. All right, let's answer some of your guys' questions here because there are a lot. Drop a comment if you guys have a question. I'm going to try and answer this right now. Awesome. Okay, sorry, I got to catch up on here because how long does it take for any Okay, Joanna, a lot of you guys are asking about impacted canines. Do you guys want me to make a video on that soon? I was going to do the live this week. Maybe I could do it next week. Let me know. If you guys want, I could do a whole video on impacted canines. But canines, the thing about them is it really depends on the angulation, how high up they are, where they're angled, where the root is. It really makes a huge impact on how long it takes for them to come in. Your age has a huge impact. When you're younger, your teeth is more, your bone is a little bit more malleable, so it's faster for the teeth to come in. But if you're a little bit older, you're pulling a tooth through denser bone, and it's a little bit hard. But okay, looks like you guys want a video on that. Stay tuned. If you haven't subscribed or liked this video, do that now, and then we will make a live about that. I forgot to put the banner on in this video. Let's put the banner on in this video. Subscribe if you haven't already, and click the like button if you haven't done that already too. Can you do a pros and cons for dental bonding for smaller canine laterals? Absolutely, mature guy. I actually did a video about veneers for peg laterals, and I think that would be the best best video to watch to answer that question. But the difference is veneers are fabricated outside of the mouth, so they're basically made on a cast. They look a lot more professional versus bonding on the teeth just directly. Not to say that bonding doesn't look good. Bonding can look really, really good, but veneers are the way to go if you want to have like that perfect replication of your other teeth because they match the shade, the color, the shape, all that jazz. Okay. All right. Have you gotten braces? I am not proud to say that I've had braces twice. The first time I did what I always preach to you guys not to do, and I didn't wear my retainer. And I was young, I wasn't smart. But now I do. I had braces. How many years ago now? I had it when I was in dental school. So that was like, I don't know, 5-6 years ago. It was a while ago, more than that. I had my braces a long time ago. But I wear my retainer very well. If you guys have had braces and have watched my videos, let me know in the comments how long you're supposed to wear your retainers after you get your braces off. Is it for a year? Is it for 2 years? Is it forever? Let me know. I want to see if you guys know. Okay, why aren't brackets placed on the last molars? That's a good question. It really depends on your case. I generally will almost always put it on the back molars if they're not perfectly aligned. If they're perfectly aligned, you could kind of disrupt the bite by putting braces on them, but it really depends on the case, depends on the orthodontist. It's a great question. I would ask your orthodontist, okay? That's a really good question. All right. You guys are asking for camouflaging underbites. Will elastics help the bottom jaw to aesthetically align with the top jaw? So elastics, a lot of people ask this. Elastics don't change the jaws, okay? They change the teeth within the jaws. So let's say your lower jaw is off to the right and your teeth are off to the right with it. Elastics will align the teeth, but your lower jaw, if it's off to the right, it will remain that way unless you have some sort of a surgical procedure because we can't change the lower jaw's positioning. You see what I mean? It actually hid Sarah's comment. A lot of people asking forever. Yes, forever. You know what I say? It's kind of facetious, but I say you have to wear your retainers as long as you want your teeth to stay straight. And everyone wants their teeth to stay straight forever. So you have to wear them as long as you have teeth, right? So forever, probably forever, absolutely forever, for life. Can you do a video about how brackets explain how to tell which? How to do a video about how? I can't understand this one. Can you do a video about brackets explain how to tell where which one goes? Like how brackets are put on, well, that's very dependent on each person's case. Like if you have, let's say, not enough teeth showing, we put the brackets a little bit higher up, because when we put when the wire levels it out, it'll pull those teeth down. On the flip side, if you have a deep gummy smile, another plug for an upcoming video. If you do that, you have to intrude the teeth, so the brackets for those are placed a little bit lower. So it really depends on the case. Braces changing. I'm gonna actually answer Josette's question because people ask this question a lot, and you know what? You are never too old for braces. Okay, never, ever, ever, unless your teeth aren't healthy for it. But if your teeth are healthy, there is no there is no age that's too old for braces. I'm laughing because Alex Mardosin's my friend, and he's asking, "Do you have a picture of you in braces?" And I do, and I actually don't have many though. And I'll share it with you guys. But I actually don't have too many because I don't think I took that many photos during that time. But no, you are never too old for braces. You could be too young for braces if you don't have the teeth for it. There, you're too young, but you can't be too old for it as long as your teeth are healthy. Okay, so go see an orthodontist, get a consult. They'll let you know what you can do to benefit your bite, your smile, how braces can help you out. So definitely get that checked out. All right, Lyndall, I see your question. I've seen it a lot here. Do you, Alex, thanks for that smiley. Canine teeth won't grow in at a certain age. You might have impacted teeth. So go see an orthodontist and they'll let you know what the plan is. Sometimes 12 years old isn't that old for teeth not to be in. Some people are dentally way more mature than their actual age, and some of them are a little bit slower. Has no real significant impact on life other than, the teeth are going to come in a little bit slower, but your orthodontist will know what's best for you. So visit one, get a consult, and they'll answer your question. Okay? Talk about some tips to strengthen your teeth and enamel. Yes. Brush your teeth twice a day for 2 minutes and use a fluoridated toothpaste, okay? I'm going to talk about this a little bit more. I'm actually going to be doing a review kind of soon on Crest's new toothbrush. It's an electric toothbrush. So stay tuned for that. But brushing your teeth really well, flossing, and using a fluoridated toothpaste can work wonders on strengthening your enamel. Because I've talked about this in my video about, I don't remember the name of the video. It might be why you shouldn't brush your teeth after eating. But I talk about how fluoride impacts your teeth. And what it does is it changes what's the structure of your teeth. Your teeth are made out of this thing called hydroxyapatite. And that's the mineral that's in the rods of your teeth, the enamel. Now, that at a certain pH, like a certain acidity, will start dissolving, which causes cavities, right? But if you have fluoride in your toothpaste, it changes it from hydroxyapatite to hydroxyfluoroapatite. And that makes it stronger and makes it so it doesn't dissolve as quickly. So use a fluoridated toothpaste. It's really, really good. Is too much fluoride bad? Yes, but you won't get that much fluoride with toothpaste. Like, unless you're like squeezing the tube and having it with a spoon, like, that's crazy. You're not going to do that. Don't swallow your toothpaste, but no, too much. You can have too much, and too much is bad, but it won't be from braces, okay? Sorry, it won't be from toothpaste. Sorry, I have to like hop in here and say this is like super hard. By the way, these lives are like really challenging. So when I film the videos, I don't have any other distraction. I'm just filming. But when I'm doing the live, I'm trying to like engage with you guys. So if I like lose my train of thought, it's not that I'm not here and focused with you guys. It's that I'm trying to like also read and keep a train of thought. So it is challenging. I hope you guys are enjoying these, by the way. Are you guys enjoying these YouTube lives? Should I keep doing these every Wednesday? Because I am having a blast doing them, but I want to make sure that you guys are equally enjoying them. So let me know in the comments here. When it comes to just wax or get it clipped. Then both. I'm on month 3 with Damon. So Mature Guy asked, when it comes to a wire that's poking out, should you use wax or get it clipped? It depends, okay? If the wire is like out and it's jamming into your gums, get it clipped, please. Or at least call your orthodontist and see what they say. Sometimes the wire could shift and they might want to put it back. Wax is used to carry you over until you see your orthodontist. But like the main purpose for wax is if like your lips are like getting caught on the braces, wax is amazing for that because it makes it so it can't get caught. It's like a little more smooth, right? But if it's a wire that's poking you, give your orthodontist a call. We might want to clip it or shift it over, things like that. So it could be, yes, we enjoy them. Awesome, cool. Awesome. I'm glad you guys are enjoying these because these are fun. They're a little bit out of my comfort zone, obviously. I never thought I'd be doing lives, and I've been doing more Instagram stories. So I'm trying to do those just to kind of take you through my day. So if you guys haven't followed me on Instagram, it's at Dr. Greg Ortho. I think I have it circulating on the corner here. But check it out. They're in the description too. Why do orthodontists take forever to change wires or to remove the braces? Well, we're not taking forever. We're going as fast as we can go. So, teeth teeth walk, they don't run. And I know it's a silly thing to say, but teeth can only move as fast as they can move. If you move them too fast, you can have root resorption, you can have gum disease, you can have a lot of problems, and you don't want that. So don't rush the process. Get it done right, get it done properly. We're not trying to keep you in braces forever. Trust me, as an orthodontist, we love seeing you, but we don't want to keep you in braces forever and ever and ever, because one, it's just not good for you. So we're not taking forever. We're going as fast as we can go. Okay. Ashley Montero says, what age should a patient get an implant? Great question. You don't want to get an implant until about 16, 18 years old. And there's a reason for this. What happens is, as we grow, our jaws get bigger, obviously, and they grow vertically. Now, implants freeze the bone level where the implant is placed. So let's say you get an implant placed. You're not going to get this done, but let's say you're like 12 years old and you get an implant placed, right? As your bones grow and your jaws get bigger, what's going to happen is that implant isn't going to grow with it. So let's say all your teeth are on this level when you're 12 and the implant's here, but then you grow and at 18 your teeth are here. Your implant's not going to move with it. It's going to stay where it is. So there's an ideal age. Usually it depends on the surgeon. I've heard as early as 16. I usually say 18 to 20 is a safe area. But what I usually do for my patients that are younger that need implants, I'll build in that tooth in the retainer. One, it makes sure that you wear your retainer because there's a tooth missing and that'll substitute it. So it's my dirty way of making sure you wear your retainer. And two is that it'll preserve that space and sight. I don't know how that activated my Siri, but Siri heard me and wanted to start talking. So I don't know why she did that, but awesome. All right, let's see these questions here. This is hilarious. So my buddy Alex, the one that was leaving comments, he's actually in court. He's a lawyer and he's watching my live in court, and he sent me a picture of it. It's pretty funny. I'll post that on my Instagram. So guys, yeah, if you want it, you have to see this photo. It's hilarious. Go on my Instagram, check it out. All right, few more questions here, guys, because I have to get ready for work. All right. Great question, John. John Kenneth Briones asked if a person lost his two lower or her two lower molars, could the wisdom teeth be substituted? Very, very, very dependent on the case, but it's very possible in certain cases. That's a great question. Ask your orthodontist in your specific case, because in certain ones you can bring everything forward, but in other ones you can't. So very good question though. I love the live, but it's 2:52 in Sydney, Australia. Oh my goodness, it's so late. I'm talking to someone from Australia by email a few minutes ago. They invented something really cool to train how your tongue positioning sits. So I'm going to try it out because I don't want to recommend anything. The idea of it is genius. I'm going to try it out. I'm going to get some of those, try it on myself, and I'll let you guys know, because a lot of people have improper tongue posture. So we're going to talk about how to fix that, okay? Let's do this. Let's finish this up with, hello Jazzy, what made you interested in learning dentistry and do it as a career? Because it's freaking amazing. I think it's one of the coolest jobs in the world. I'm going to end it with this one because it's a very positive note, and it gets me in the right mood to go to work. But it is such a cool job. So dentistry, orthodontics is amazing, or dentistry is just as cool. It mixes all the things I love. It mixes art, it mixes science, it mixes interpersonal skills. I get to hang out with people. The cool thing about ortho, I'm going to talk about ortho first, but I get to hang out with my patients. They're like my friends. I see them every month. We are on a journey together to increase their confidence, make their smiles beautiful, make them healthy. It's just so much fun. You get to see them, you build a relationship with them. It's great. I get to use my artistry skills. So as you can tell from this YouTube, I have a creative side. I like, capitalizing and using that. So dentistry gets to capture the science, I'm a molecular biologist for undergrad training, and I have a master's degree in oral biology. So I love basic science, science and research, but I also love art and caring for my patients and interacting with people. So it's an amazing job. I'm happy to do a live. Maybe I'll do a whole live for people that are interested in becoming dentists or things like that. I think it'd be a lot of fun. But just an amazing field. Guys, I'm going to vet through these questions a little bit later, write them down, maybe answer them in another career. My brain's still there. Answer them in another live, in another video, but it's kind of hard for me to read them all and be present with you guys. So, with that being said, I'm going to sign out here. We'll answer another one. Sorry it's so late for some of you guys in the world. It's really like the best time for me to do these. Maybe we can do them later on the flip side of the clock, but then it makes it hard for other people in the US. I'll pull it a little bit more. But with that being said, I am going to sign out here. Queen, you just joined. I'm about to sign out. But if you guys enjoyed it, be sure to give it a thumbs up. Share this video with your friends. Share this channel. If you know anyone that's going through orthodontic treatment, share this channel if you guys can. I really want to see this thing grow. It's growing really fast, and we're doing amazing. I mean, we're getting close to 75,000 subscribers. That's crazy. 75,000 subscribers. So thank you guys. Goodbye from the United States. You guys are amazing. I will see you guys. Sign in Saturday. We're doing a live patient procedure. Check it out. Much love. Stay safe out there. Peace out, guys.